Hello, everyone, and welcome to another episode of Faces of Phyla, where we discuss phage technology and acne. My name is Dr. Yug Varma. I'm your host, and I'm also the founder of Phyla. I'm a scientist by training, a biochemist, and a microbiome researcher. I got my PhD at Johns Hopkins, and I did some microbiome research at UCSF before I started Phyla. And today I am delighted to be joined by Dr. Ritu Saini at New York. Dr. Saini is a board certified dermatologist who received her medical degree from the New York University School of Medicine, and she's a native New Yorker. She specializes in Mohs micrographic surgery, cosmetic dermatology, dermatologic, and laser surgery. Dr. Saini is a fellow of the American Academy of Dermatology and a member of many medical societies, including the American College of Mohs Surgery and the American Society of Dermatologic Surgery. She's currently director of dermatologic surgery at St. John's Episcopal in Far Rockaway, New York. And she's a clinical assistant professor at NYU's Department of Dermatology. Dr. Saini has published extensively and is on the medical editorial review board at JDD, Journal of Drugs in Dermatology. She's lectured both nationally and internationally and has made several media appearances as a spokesperson for the Skin Cancer Foundation. With a resume like that, I am delighted to welcome Dr. Saini. Welcome to Faces of Phyla. How are you doing today?
Thank you so much, Yug. Thank you for having me. I'm doing great.
Awesome. Well, I'll kick things off with a simple and obvious question. How do you currently treat acne, and what are your patients' chief concerns?
Well, traditionally we all trained in our residencies and, there even afterwards in practice to treat patients pretty traditionally with, for acne in terms of looking at it as, an issue of oil production, an issue of hormones, bacteria. So we always were trained to address those three basic tenets. Excess oil, so we have our retinoids, then we have the clogged pores because bacteria comes, because why is bacteria coming? Because the oil acts as food for the bacteria. So this is what we were trained in our residency. We actually used to draw pictures of this for our teenage patients, even at University of Miami Department of Dermatology, where I trained. This is how we were taught. Is what is behind acne, which is all true. This is the basics, right? And then the bacteria is there, oil's there, bacteria comes, and what happens? The body fights that bacteria, and that's where you get this inflammation. That's where you get these clogged pores, whiteheads, blackheads, what have you. And whether it's hormonal acne, basically the basic tenets are the same, right?
Mhm.
So I was always trained to look at it from those three pillars. So we have our retinoids, we have our topical antibiotics, we have our keratolytics like benzoyl peroxide. Traditionally, that's how I was brought up to do that. But recently, especially since I've been trained now in integrative dermatology, so I did a certification course some years back that actually brought to the forefront what's the underlying cause of many of the dermatologic diseases that we treat. From an integrative approach, what else can we do for our patient other than just prescribe these few medications or these typical, this regimen that everyone's doing? How do we get to the core issues?
Mhm.
So I've kind of changed my tune a little bit, and I do think about how our microbiome, for example, how it affects how our acne is, what's happening, from that perspective.
Amazing. And I mean, that was just so good in terms of giving a broad sort of view of the landscape of acne and really educating people about what acne is, how different treatments affect different types of acne and the different stages of acne pathogenesis. What do you see most in your practice? Are you seeing more hormonal, cystic, adolescent acne, bacne? Tell us more about that.
Sure. So I see everybody in my practice, but I tend to get more young women than children, than kids. I do see my fair share of teenagers, but it's predominantly women in their 30s and 40s and beyond that have acne. Much of it is hormonal, not always, but a lot of it is. Um, that changes the landscape for me, and how when I go back to my days of training and residency and hearing those three pillars, it changes because these women cannot always tolerate these medications. Something like a prescription topical retinoid is just too strong for them to use chronically, to use every day. They have to go to every other day, twice a week. And it may not be so effective at that point, right? The other thing is, we've been also treating, because it's a hormonal acne in these young women, we've been treating a lot with uh, spironolactone, which actually addresses the androgen part. So androgens are male hormones that we all have, even in normal amounts. It does not have to be high amounts. Even in normal amounts for a normal woman, that can cause acne. It causes excess oil production and therefore can precipitate acne. So that's a lot of what I do also. I think we've moved away from doing long courses of antibiotics. Long ago, people were on, these doxycycline, minocycline, these tetracyclines for years and years and years. And we realized that's just not a good way, because besides being, bad for the gut microbiome, which it does alter dramatically, there's also other side effects that comes from these medications that we have to really watch from long-term use. So I think nowadays we're doing just a couple of months just to cool off the skin. And then we're moving towards other things, more long-term solutions like spironolactone, like even isotretinoin. I know these are harsh medications, some of them with side effects. I don't put everyone on it lightly. These are reserved for more severe cases, but I do find that actually combining something like Phyla and something that addresses the microbiome with some of these medications is actually really effective.
Yeah, and I think it's really important to note that a lot of people who have, especially with sensitive skin, but a lot of people who have adult acne have often tried a lot of things before for their acne. And as a result, some of that comes with skin damage, right? Because there's redness, irritation,
Correct.
and all those side effects that come as part of these harsh treatments. And it's really important to note that acne is a chronic condition, right? You get it over months and years, and so you need something to treat them over that time. And for example, antibiotics or even isotretinoin, you're not going to just keep someone on a continuous dose.
Exactly.
You noted how harsh they were.
Exactly.
So you mentioned that a bulk of your patients are in this adult acne category and they're women. Do you approach treating different types of acne differently? I mean, the answer is yes, but just tell us a little more about that.
Yes, 100%, 100%. Obviously, I have to look at what's precipitating this acne. Where is the root cause? So in these women, a lot of times it's hormonal, right? It flares with their menstruation cycles. It flares with different changes in their lives, post-pregnancy, what have you. It gets better when they're pregnant. It's all different things that are happening based on what's happening in their lives, right? So obviously, yes, we have to address that component. So that's where something like an anti-androgen will come into play, right? But I find that obviously you can't keep these people on these medications forever, right? And it might be a period of time where you take them off, and then what do you do? So I like the fact that I can combine different things now and still address that aspect. You know what I mean?
Yeah.
We can do topicals now. There's topical medications that address androgens. They're not as effective. But by addressing something like getting to the cause with the microbiome, that's really helpful, because these women cannot tolerate something too strong for too long. So you need a long-term solution that they can use, especially when they're in the mild to moderate phase, and they just need something to control the flares, prevent the flares. This is really nice to combine with some of the more traditional, prescription medications.
Yeah, absolutely. What gaps do you see in current existing treatments?
Well, I think we haven't really moved very far in acne. I mean, there hasn't been too much out there. Things aren't really changing much. You might get a new topical that's a different percentage. They combine a couple things together, they micronize something, they change the vehicle, but the inherent treatment is the same. It's always the same, right? And it's not getting to the actual root cause of the problem. We're just temporarily masking it. Even with medications that are really effective for acne, like isotretinoin, like spironolactone, these are not permanent solutions and long forever solutions. These are medications you can't use when you're pregnant, for example. What do you do then? That's a huge gap where we're left with very little and at these points. Topical retinoids are great, but again, when you get to a point where you can't use them, what happens? So I feel like we just haven't become revolutionary in acne. We're just kind of evolutionary there.
Yeah, I fully agree. And I feel like innovation in the last 40 years has really stalled on acne,
Mhm.
especially when you look at other dermatological conditions like AD, for instance, where in the last
Yes.
10 years, there's been a profusion of approaches and drugs that have been developed. I mean, speaking of innovation in acne, phages are a
Mhm.
relatively new innovation in acne, and they're kind of a culmination of a lot of the observations and the research that has been done in acne over the last 30, 40 years. Now, just kind of setting the table, phages are naturally occurring viruses
Mhm.
that kill bacteria. And the phages for C. acne specifically have been shown to be abundant in healthy skin. So people who don't get acne, they have a lot of these C. acne
Yeah.
stages, whereas people with acne, they're actually deficient in this. You kind of find it rarely, if at all. And so phage technology is kind of mimicking an ecological balance that's naturally found in healthy skin and in nature. What is your opinion on phage technology as well as like maybe other microbiome approaches specifically towards treating acne?
Oh, I think this is exactly what we need right now because it's more targeted. It's easy to say, okay, we know C. acnes is involved. We know it's a culprit. So we're going to wipe it out. But what else are you wiping out? Right? What else? What other good stuff are we getting rid of? And that forever disrupts the skin barrier. That forever alters it. And so, I mean, even just take something like benzoyl peroxide. We've been prescribing that in conjunction with topical clindamycin for ages because we were told that there would be resistance if we didn't do that. The problem is it's very oxidative, right? It does not lend itself well to a middle-aged woman who's looking to, keep herself young, you know, preserve the collagen, keep that going if it's oxidative. We want antioxidative processes going on. We don't want that other process. So this is where I think going to this direction rather than just kind of like throwing the kitchen sink at everything and hoping this sticks. It will stick, but what else is going to stick? You know what I mean? We don't want everything gone, wiped out. We need to preserve the good stuff and target. It's a more targeted approach that I think is really useful.
Yeah, absolutely. One of the superpowers of phages is that they are so targeted. They only kill
Mm-hmm.
the bacteria that they're going after instead of killing the whole thing, the
Right.
whole microbiome, and off target, good bacteria that are part of the mix. And I liken it with, if you go out in your garden one day and you find a weed on your lawn, you're not going to set your whole lawn, your whole grass on fire just to get rid of the weed. But that's what we do. We set fire to our microbiome every day if we use harsh products on them. And I think, obviously, if you're younger and you're like, hey, I want this gone by prom or next week or next month, whatever, I'll do whatever it takes. I'll put harsh things on my skin. But I think now even the teenagers and the young folks are much more aligned towards an attitude of longevity of skin health, right?
Mm-hmm.
Where they're
Mm-hmm.
like, hey, I know there's isotretinoin out there, but before I take that, is there something else that can help that isn't as harsh and harming to my body? And I chalk that up to a lot of obviously self-awareness, but also a lot of education, where a lot of young skincare consumers, especially, are very educated about the ingredients they want, where they want them sourced for, what ingredients they don't want, in fact. Um, what is the most outlandish thing you've had a patient tell you they tried for their acne?
Um, a good question. I have to think about that. You know, really, they're just the way they. Unfortunately, people go try to extract the picking and that's. it's not really outlandish in the sense that it's actually not as uncommon as we think, but it's bad. It causes scarring. I mean, it can cause hyperpigmentation.
Yep.
Teenagers that have no patience, they get very turned off by the need for so many steps, and the compliance is not there. So, I've had things like that happen. People using very oily products, thinking that that's going to somehow help them,
Hmm.
just because, cocoa butter is used everywhere else. It's not going to help your acne. It's going to be worse, this type of thing.
Right.
Nothing too crazy, thank God, have I had
Yeah.
to deal with. But, every day people come to my office wanting Accutane and isotretinoin, who may not be the traditional, um, you know, patients that really I would put on it. They want it because they're frustrated that their current regimen is not serving them anymore. And they feel frustrated because they're maybe 30s or 40s, and they're thinking, why am I still going through this at this age? I want this gone. So it's kind of similar to what you were saying about someone who needs to be ready for prom. I'm seeing those people that are that much older than that have that same kind of sense of urgency.
Hmm.
So in those people, I will sometimes give in and put them on a low dose isotretinoin. But what I've been doing now is I've been pairing it with like the Phage system, the Phyla system, telling them use this now. Use this because you can't really do much else while you're on this. And this is going to at least treat the underlying cause. And once you're done, once you're at a point where we can start getting you off these medications, this is what you can stay on. This is what you can stay on to prevent flares again, to prevent a relapse. And so I don't feel like it's an either or. I think you can really marry the two in
Hmm.
many ways. In many ways.
Yeah, and I think
Mm.
it's a good point to ask you how you use Phyla in your practice. I mean, how do you kind of triage patients and say, I'm going to use this as mainline or as a combo or as an adjunctive?
I mean, if they're coming to me frustrated, they've tried a million things and they're still having these breakouts, and they have their, sights set on one thing or another, it's sometimes hard to steer them away to something totally different. But if they're kind of come in open minded, and it's, something where I feel like they will respond well and not need too much else, I might say to them, just try this for a little bit. Just try this and see how you do. Somebody on the milder side, maybe, who hasn't been struggling for so long that they're not already at the point where they are just done with everything, and they already like have done, you know, tons of research and they've read everything. Those are the best people to start fresh with Phyla. And I've had people do really well with just that alone.
Yeah, yeah. And I mean, I want to point out another thing that you said earlier, which is that acne is a chronic condition. And once you get kind of the C. acnes overgrowth out of your microbiome, or once you get your microbiome in balance, Phyla is a great kind of maintenance regimen because
Yes,
the phages will ensure that the C. acnes overgrowth is suppressed and that
exactly.
inflammation doesn't come back.
Right.
Um, can you share a success story of a patient using Phyla?
Yeah, I've had a few young women in their 30s that came in. They said, we never really had too much as teenagers, but hormonally, now I'm noticing I'm getting a few pimples every month on my chin, on my, jawline. Stressful times, I get more, and I don't really know what to do. And I'm very sensitive. My skin is very sensitive. I'm also sometimes I get a little rosacea. They might be a little rosacea prone or what have you. They're just extremely sensitive. Oh, I've tried retinoids before, and I couldn't tolerate it, and I just really don't know what to do. These people have worked. It's been working very well for them, putting
Amazing.
them on that system. Yeah.
Yeah, I'm so glad to hear that. What do you wish patients knew more about acne?
That it's nothing they're doing per se. It's not their fault. They're not eating, you know, there's a lot of myths around acne about the food and chocolate and old school stuff, but we actually do know that there is a role of diet. We do know that now. We do know that processed foods trigger cortisol production, insulin like growth factor, then we get oil and all that. We know the mechanisms of that. But it's not, you can't look at that in a vacuum. That's just one contributing factor. So it's just that their body produces this oil that's causing this overgrowth of C. acnes. It could be from a different, a bunch of different reasons. It could be for, hormonal changes or whatever, but it's not them. It's so complex that it has to be addressed from different angles. That's what I want people to understand. It is a very complex condition, and that we have a lot of trial and error is necessary sometimes to make things happen and to get the changes they want.
Absolutely. I mean, acne, I think one of the big challenges is it is multifactorial, it is complex, and figuring out the right lever to pull for a person, right, depending on their skin history, their acne history, their skin type, their genetics, the diet component, as you mentioned, it does take some time to unravel that. Last question. What do you hope the standard of care will look like for acne in 5 years? What are your hopes for it?
I do hope that things are incorporated more so to address the underlying causes, the overgrowth of the bacteria, the bad bacteria, the good bacteria. Let's improve the good bacteria, reduce the bad bacteria. Let more targeted approach, a more surgical strike, if you will. That's what my hope is, that we get into more revolutionary ways to treat, rather than just evolving the same stuff over and over again, rebranding, putting a new name on it, repackaging, new vehicles. We've had enough. It's like we need. I think that it should be a better marriage between these two sectors. We know that there are ingredients that need to be used from a traditional Western standpoint of treating acne, but there's also the whole other side of it, the integrative approach. I'd like that integrative approach to be more mainstream.
I love that. I love that word integrative, and I think it has so much value, especially for a complex condition like acne. And I fully support the idea of having something more targeted, something more tailored for the bad bacteria, and looking at the microbiome not just as, oh, all these bacteria are bad, I want them gone, but saying, oh no, there are good guys and bad guys, and
Right.
we want bad guys gone. Amazing. On that note, Dr. Saini, thank you so much for joining us. It was a pleasure having you. And stay tuned, everyone, for another episode of Faces of Phyla dropping soon.
Thank you so much. You